Hello, thank you for joining me today. I'm Tanya Atagi, and I would like to talk to you today about body contouring, in particular liposuction and tummy tucks or abdominoplasty. So these are two very popular and common procedures in plastic surgery, particularly for patients after weight loss or having pregnancies, children, and they're very gratifying procedures. So when we talk about liposuction, for example, we're really talking about fluff. So if your skin quality is very good, you don't have a lot of extra skin, liposuction is a really great contouring procedure. And so when we think about fat, really they're like stretchy U-Haul storage units. And so when we gain and lose weight, we're not really, for the most part, making new fat cells or losing fat cells. You're just taking the fat cells that you have and filling them more or less. And so it can be really frustrating, and as many of us know, that you can't spot reduce. And so say you just tend to carry it on your hips. Well, when you lose weight, maybe you lose it from your breasts or your face. And so it can be frustrating in terms of, you're doing really great with your nutrition, you're exercising, your hormones are balanced, your thyroid is good, all of those things. And if you're successfully losing weight, it might really be that it's coming from areas that you don't need to lose it. And the last place it comes off is the first place you need it to come off. The great thing about liposuction is that really we can spot contour, we can spot sculpt, we can spot reduce, and we're physically getting rid of those U-Haul storage units. Now, this being said, it's not cheating in terms of you can't have liposuction and say, well, I have my liposuction, I'm going to eat 12 Big Macs every day or stop exercising. Sometimes patients will say, well, it doesn't work, it just comes back somewhere else. Well, it doesn't really just come back somewhere else. I mean, you do have other U-Haul storage units in other parts of the body. So say we're removing, sculpting, contouring your back and bra line area, or your flanks and hip roll areas, or your tummy, or your outer thighs, or your inner thighs, or the backs of your arms. We can remove fat in an isolated fashion from those areas, but if you're not doing all of the other things to help you maintain a good healthy weight, then where is it going to go next? So maybe we've removed it from your tummy, but now your arms are getting bigger. And so it doesn't really just go somewhere else, but you have to maintain a good lifestyle in terms of maintaining your results. Now, patients that are good candidates for liposuction are really patients that have good skin. So it's sort of a stuffing versus a sack type of conversation. So if you think about it, the best case scenario is you've got youthful skin, you've got nice elastic, thick skin, and we're removing just a tiny little bit. Because if we remove that little tiny bit of fluff, then the skin is going to pop back very nicely. And it's going to heal, be very nice and smooth. Now, the worst case scenario is if you have a really large volume of fluff that we're removing and your skin envelope or the sac is not great, meaning you have extra skin, you have loose skin, you have saggy skin. So if we remove a large volume, you can imagine that we're really just emptying out that skin envelope and it's not going to snap back nicely, and we potentially have a different problem on our hands. Part of the reason for asking you to come in for a consultation is that we want to really evaluate your particular situation. So is it a good balance of the amount of adiposity or fat that we're removing and a good balance in terms of getting a good result because your skin is going to do well? That's kind of the discussion that we have with liposuction. And I use a technique called the power-assisted liposuction. And basically, I love the technique because there's a vibration to our suction cannula that pre-breaks up the fat. So I feel that we can get nicer, smoother results because sometimes there's fat, nice, fluffy, yellow, buttery fat that comes out very easily. And then there's also fat that can be kind of fibrous and stubborn. So you can imagine if we start suctioning an area and all the yummy, buttery, fluffy stuff comes out first, and then we have trouble, or it's more of a challenge to get the more fibrous, dense fat out, then there's a greater risk of having some contour irregularities. Now, unfortunately, we can have those issues with any kind of liposuction, but what I find is that with the technique that we're using, where we're breaking up and emulsifying the fat first, that it comes out more evenly and we can get smoother results. And I think really we can be a little bit more aggressive. I think also if you've had liposuction or surgery in an area before, it really helps to break it up nicely, again, to get that nice smooth result. And with this particular technique, we're actually suctioning at the same time. So the procedure goes a little bit more quickly, because there are techniques out there where you're breaking up the fat first and coming in and suctioning later. So because we're doing this simultaneously, it really cuts down on the anesthesia time or the amount of time that you're in the operating room or in our office. Now, there are instances, depending when we can do the procedure in the office, if we're doing a small volume or if we're doing one larger area. So the limit in terms of how much liposuction we can do in the office really depends on our lidocaine dosing, meaning the problem with using a lot of lidocaine or numbing is that it can cause heart arrhythmias, and obviously we don't want that. But there's a very safe guideline for this. So if we're doing smaller areas, if we're doing maybe one medium to large area, things like that, then it can be done very nicely, very safely and comfortably in the office. At the same time, if you're somebody who is going to be kind of creeped out hearing me say you're going to be relaxed but awake, and you really just want to be asleep for the procedure, or if we're doing multiple areas or multiple areas, then we really do it in the hospital or ambulatory surgery setting under the care of an anesthesiologist, where you just be completely asleep. So depending on your particular situation, we do have different options for the liposuction. And the nice thing about liposuction, one of them, is that we do it really through a very small little incision. It might be a centimeter or so at its longest. And we do, of course, try to hide those scars in natural skin creases, in your groin, things like that. As I kind of alluded to, liposuction can be used for many areas of the body. So common areas are the neck and submentum. So if you have a little bit of fullness in the neck, the arms, the outer thighs, the inner thighs. Occasionally we'll be doing calves or ankles. That's not as common. The back bra line area, the hip rolls or flanks, and the tummy. Those are almost every part of the body, but really depending on where you like to keep it, meaning I call them our primary fat stores. Those are sort of the areas that it's really the first place that anything extra goes and the last place it comes off. Of course, those are the areas that we're usually working on. And also, we can use the fat. So if you're somebody that's been having fillers placed in your face, this is a great opportunity to put something that is yours, your own fat, and can give us some longevity into your face. We use it in the breast and the bottom. If you have a scar divot from an injury or other surgeries, those are really great places to use the fat. So that's something to consider as well, because we certainly don't want to throw away some good stuff if we're able to use it someplace else. So that's something to take into consideration. But liposuction can be a really great contouring procedure. Now, if we're talking more specifically about the abdomen, if you've had a big weight gain, if you genetically, you just tend to have a pooch in your tummy, you have extra skin, loose skin, you might be a very good tummy tuck candidate. And I would say many of our patients that have had a pregnancy are good tummy tuck candidates. So what is the difference between liposuction and a tummy tuck or an abdominoplasty? Well, the liposuction really only takes care of the fluff or the fat. When we talk about a tummy tuck, the changes that we're really trying to correct with an abdominoplasty are really what I feel to be three things. So we have a left and a right abdominal muscle, or our abs, or rectus abdomini, and there are girdle panels. So the muscles are very long. They attach from your pubic bone up to the ribs and the breastbone. They're very wide, flat muscles. And so before weight gain, maybe again genetically, having pregnancies, those muscles are pretty much together. And with pregnancy, weight gain, whatnot, they tend to separate. And they do come back together to some extent, but I don't know that they ever completely come back together. So it's like having your girdle panel splayed apart. So you may be doing 500 sit-ups every night and have very good, strong muscles, good tone, But you can imagine if your girdle panels are sitting apart that you're potentially going to have a little pooch. So even some of our really lean patients after having kids, they might be very thin, but they may still have that pooch. So one of the first things that I do to correct that is we don't cut the muscles, but we corset them back together again. So we use dissolvable suture to suture those muscles back together, and that helps to really support the tummy, flatten the tummy, and because we're cinching the waist, it really helps to give patients back that waist definition. So again, with weight gain, having kids, oftentimes we have a very flat silhouette or blunted, and so it really helps to shape the waist or cinch that belt. Now, the other couple things that happen with pregnancy are that we stretch the skin. So most patients, like even if you don't have stretch marks, your skin is probably looser after having weight gain, pregnancy, and whatnot. So we're damaging that collagen in the skin, so the skin is looser. And so we can help with that. And also the other thing that a lot of people don't realize is that our bodies make new skin. So we use this concept of tissue expansion when we're doing breast reconstruction. So if a patient's had a mastectomy for breast cancer, oftentimes one of the techniques that we use is to put basically a fancy balloon under the skin. And over time, we gradually fill that fancy balloon. And not only does it stretch the skin, but it actually stimulates the body to make new skin. So if you think about it, if you're going from here to here, I mean, your body's pretty impressive, but you've also made new skin. So diet and exercise does not bring the muscles back together. Diet and exercise does not fix loose, damaged collagen, and diet and exercise does not get rid of extra skin. So the tummy tuck procedure or abdominoplasty is really designed to address those things or those changes that happen with weight gain, having children, or even genetics. You know, maybe you didn't have good muscle support to begin with, or you've always had a pooch, or you've always had some loose skin. And also, particularly if you have stretch marks, we may not be able to get rid of all of them, but basically what we're doing is we are getting rid of a football-shaped area of skin and any fluffy stuff or fat underneath from the belly button down to where someone might have a C-section scar, or we try to keep the scar below your bikini line. So we're getting rid of this football-shaped ellipse of skin and underlying fat. We loosen all of the skin above the belly button and we're pulling it down like a window shade. So you can see how that's going to give some tightening and flattening. And then the exchange rate for this basically is that you have a long scar, and some people do have an objection to the scar. It does go hip to hip. But if you think about it, you can't take your pooch, damaged skin, loose skin, extra skin, stretch marks, and tuck it into your bikini line, whereas very often we're able to get that scar line below your bikini line. So it tends to hide very nicely. And then you also have a little scar around the belly button because when we've got all of this skin loosened up, we leave your belly button, it's attached to your abdominal wall, and it's sort of sitting there like a little mushroom by itself with all the skin loosened around it. And that we do that because the blood supply is now coming from the belly button. And so when we bring that skin down, we need to make a new little window for your belly button to peek out. And so that's why you have a scar around the belly button. Now, if you're somebody that has a very high riding belly button, or you don't really have a lot of loose skin, maybe you just have that pooch that we want to correct the muscles, then we'll do what's called a partial tummy tuck, where we're not really removing all of the skin from below the belly button down to where you might have a C-section scar or your bikini line, but we're really removing skin from below the belly button. And in that case, particularly, you might be someone that has a high riding belly button, and so we need to do this partial tummy tuck. We still do the muscles. The scar might be a little bit shorter, but not necessarily. And you don't have the scar around the belly button because instead of leaving your belly button attached to the abdominal wall, like a little mushroom, we actually detach your belly button at the base and allow the skin to provide the circulation to the belly button. So the belly button actually moves up and down with the skin. So The tighter we pull your belly button, the lower it's going to move. But you can imagine if we're not having to do a lot of skin tightening and your belly button is high riding anyway, that's going to be fine. But a full tummy tuck is really, if you really have enough skin for a full tummy tuck, we want to be doing a full tummy tuck because we don't want your belly button to all of a sudden be sitting above your pubic hair, because that looks strange. So we're going to help to evaluate you and your particular anatomy to determine what type of a tummy tuck that you need. Are you really a liposuction candidate, and do you not need skin removed and muscle tightening? So that's where having you come in for a consultation is really helpful, because we can, of course, personalize the care for you. Now, multiple procedures can be performed at the same time. There are surgeons that will liposuction the tummy at the same time the tummy tuck is done. I don't generally recommend that. I just feel like we're disrupting a lot of the natural blood supply to the skin. So if you do need liposuction after a tummy tuck, that's something that can be done in the office. And so I tend to prefer to do it that way in a stepwise fashion. But in all honesty, our tummy tucks are pretty flat, so I don't really have a lot of patients that are coming in for additional liposuctioning of the abdomen following a tummy tuck. As far as the procedure, the abdominoplasty or tummy tuck procedure, we do this in the operating room, whether it's in the hospital setting or the ambulatory surgery setting. We do it with you asleep. We use our anesthesiologist that will keep you nice and comfortable and safe during the procedure. And really how long it takes depends on partly your incision, how much work that needs to be done. We do all of our sewing by hand. All of our sutures are dissolvable. I do use a couple of little drains. They look like IV tubing. They lay under the skin flap because what we want is that tissue healing back together nicely, so we're not collecting blood or fluid under the skin that needs to be drained later. So those drains, super annoying. Patients tend to do fine with them. They come out in about a week or two. As far as complications, really, unfortunately, any of the complications you can have from any kind of procedure, problems with the anesthesia. I mean, really, the most common cause or problem we have with anesthesia is postoperative nausea, and we give you everything we can think of to prevent this. Again, anesthesia tends to be very safe. They're monitoring all of your vitals. They monitor your nerves. They monitor how awake or asleep you are. The anesthesiologist is with you every minute of your procedure. Unfortunately, we can have bleeding, just like with any surgical procedure, that we have to run back to the operating room to take care of. We do ask for 2 weeks of no strenuous activities, primarily to avoid any sort of bleeding problems, getting bleeding stirred up by being too active. We also ask for 6 weeks of no heavy lifting or doing abdominal muscle heavy activities like crunches and maybe heavy duty biking or push-ups, sit-ups, things that are going to be engaging your tummy muscles. And it's really no different than if you were to have a hernia fixed or something like this, where we're just asking for the 6 weeks to allow your tummy muscles to heal and get some strength in there. So 2 weeks of no strenuous activity, 6 weeks of no heavy lifting. Other types of complications, unfortunately, with any surgical procedure, again, you can get an infection. I would say that's pretty uncommon. If something like that were to happen, more often than not, we can treat it with antibiotics. You can have things, I would say it's not uncommon to get permanent numbness around your belly button area, because we are disrupting a lot of the nerves when we release all of that skin for the tightening. The nerves are going to be growing back from the sides and from the center, and so sometimes they just don't make it back to the belly button area. You're probably going to have a pretty large patch of numbness to begin with, but as those nerve endings grow back, then that patch of numbness is going to get smaller. You can have things like slow wound healing or stitches that spit. So again, all of those sutures that we use are dissolvable, but sometimes your body's like, hey, I know you don't belong here. I'm going to do whatever I can to get rid of you. So sometimes we have little stitches that will spit. You can have slow wound healing. If it happens, it tends to be in the lower center of the scar, because that's the furthest from the blood supply. There's the most tension, and so sometimes that can cause a problem. Now, most of our patients do very well. We don't have those circulatory problems, but if you are a smoker or a vapor, or if you have clogged arteries or atherosclerotic disease, or if you are diabetic. Those are things that we're going to want to know about, because we need to be extra careful, and you are at higher risk of wound healing problems because your native or natural underlying circulation might not be as good as someone who doesn't have those problems. Particularly with the vaping and smoking, we do need you to stop smoking, not one cigarette, not vaping at all, for at least 3 months before your procedure, because we want to optimize your circulation, your ability to heal, your ability to keep your skin alive, your ability to fight infections by maximizing the circulation to the area. We could have problems with slow wound healing again, areas that separate, open up. Those are not insurmountable problems. We may be just slow to heal, where we're having you do some dressing changes. We can have things as serious as the belly button dying because it's not getting good circulation. That's not generally a problem, but again, if you have underlying problems with your circulation, you're at a little bit of higher risk for that. We do follow you for a year, because it really takes a whole year for everything to heal and be done doing what it's going to do. We generally see you every week for the first month, at 3 weeks, 3 months after that, at 6-month visit after that, and a 1-year visit. And our 1-year visit is really kind of our box check. So if there are things that are bothering you, there's something about your scar, you have a little pucker, what we call a dog ear, at the edge of your low transverse scar, things like that, those are all things that can be fixed. So we really follow you for a year, because we want to make sure that everything's going well and that we're happy with our results at that end point. Those are just some tips and some thoughts about body contouring, again, the liposuction and the tummy tuck or abdominoplasty procedure. If you would like us to take a look at you so that we can talk more specifically about your wants, your needs, and your anatomy, get all of your questions answered, please give us a call, and we'd love to see you. Thank you.